Welcome to Transitioning to Medicare Part 1. If you're viewing this as a slideshow, which most of you will be maybe, or listening to the recording, our SHIP and our SMP programs are not sponsored or affiliated by any advertisers who you might see in the presentation. Our programs offer free, confidential, unbiased assistance to residents of Carroll County, Maryland. We not only do not recommend, but we do not promote any outside entities offering advice on Medicare. If you'd like a one-on-one appointment, please call the number below. Thank you. So, my name is Lois Romeo. I'm representing SHIP, the State Health Insurance Assistance Program. It is local help with Medicare at no cost, confidential, unbiased. We are trained counselors. We have to go through training and be tested on it. We can offer education such as this. We can do one-on-one counseling. That is by appointment at our offices. We can offer benefit program review. That could be reviews of the Medicare costs. It could be a review and comparison with a retiree program if you're trying to compare that against Medicare. But you would have to bring your retiree information with you. We can also do application assistance. That's typically for financial venues where you could get some assistance. And we can do problem resolution. It is available to all Carroll County residents. This is a nationwide program. So if you know somebody that's in another county, these are their phone numbers. You can just pass this along to them and they can call their local SHIP office. Or they can go into Central Medicare, the numbers at the bottom of the page. So Medicare is health insurance for people over 65. It's also for people under 65 with certain disabilities. And at any age with end-stage renal disease, ALS, which was Lou Gehrig's disease. There are a number of diseases like that. There are a couple of them that it could be at any age. It was enacted originally in 1965 and it is growing rapidly. In 2025, there were 69.4 million people on Medicare, and that's projected to grow to 80 million by 2030. 10,000 people enroll every day in Medicare. And so if you have trouble getting through to the central number, that gives you an idea why. The Part D prescription drug benefit did not become effective until 2006. There are four parts of Medicare. Part A is your hospital insurance. That would be when you're actually admitted to the hospital. If you were to go from there to a rehab center, a skilled nursing facility care, it's going to be your home health care, portions of your home health care, and hospice care. So that is basically, think of it as doing your room and board and, the nursing and that kind of thing in the hospital. All other medical is going to fall under Part B. So that's going to be your doctor's visits, your outpatient, ER, durable medical equipment, chemotherapy. Some of your home health falls there. Preventative services, kidney dialysis, mental health, labs, all of those are going to fall under Part B medical insurance. Part D is purely Medicare prescription drug coverage. And then you can choose an alternate way of getting your Medicare, which is a Part C, Medicare Advantage plan. That will always include A and B, and most of them, particularly where we are, will include Part D. So how do you go about enrolling in Medicare? You can enroll through the Social Security Administration or through, if you're a retiree of the Railroad Board, you can enroll that way. So the enrollment for Medicare is through those agencies. The actual administration of Medicare is through the Centers for Medicare and Medicaid Services, which is called CMS. So that can be automatic for your enrollment. If you're already receiving either a Social Security check or a railroad retiree benefit, then enrollment in Medicare is automatic. What you would see happen is a package that looks like the one on the slide would be sent out to you 3 months before the month you turn 65. Or if you are under 65 and on disability, it would come out to you on the 25th month of disability benefits. That does include your Medicare card. So you're going to get lots of ads at this point. Um, Feel free to toss them, but please open them first and make sure it's not the legitimate one coming from CMS and Social Security, which has your card in it. You can keep that card, um, and it will come with both Part A and B on it, or you can return it to refuse Part B. We'll talk a little later about why you might do that. You would, if you do not want Part B right now, then you would follow instructions and return the card. So if you're not receiving Social Security benefits, you may need to proactively enroll in Medicare. So you can do that online at ssa.gov. You can do it by calling for an appointment at your local Social Security office, which is ours is in Westminster. You can do it over the national SSA number, and we give you some times that are the easiest to be able to get through to them. If you are a retired railroad worker, then you have to use the number on the right-hand side. So when do you enroll in Medicare? So first off, if you or your spouse are still actively employed and covered by active employment insurance, you do not have to enroll in Medicare at age 65. We'll talk about why some people do and some people don't. But if you want to be enrolled at age 65, your initial enrollment period is a 7-month cycle that starts 3 months before the month you turn 65 through 3 months after the month you turn 65. Your coverage, if you enroll during those first 3 months, is going to start the first day of the month you turn 65. If you wait and do it any of the later 4 ones, it's going to start the first of the following month. There are some other times you can enroll, but you may pay a penalty if you delay. So, first decision is, should you keep or sign up for Part A? Well, for most people, anybody, you or your spouse, has worked 40 quarters and paid into FICA, it's premium free. You can contact Social Security to sign up. The reason you might not want to sign up for Part A is if you have a health savings account. You may use the money that's in that health savings account once you're on Medicare, but you can no longer contribute to an HSA tax-free once you're enrolled in Medicare. So that's a decision you get to make, whether you want to sign up or not. Some people will go ahead and sign up because it's just secondary to their employer insurance. You may want to delay Part B. So Part B is a little more of a decision. So first thing you need to do is check with your HR department to find out how your current coverage works with Medicare. So this is where you have to make a decision. In some cases, your employer will require that you have Part A and B at age 65 to have their coverage. So again, if you have active employment coverage, you don't have to sign up unless your HR department tells you it is required for them. If you do not sign up when you first turn 65, there is no penalty as long as you enroll within 8 months of losing coverage through active employment. Now, remember, that would be 8 months you would not have coverage. So that's why not too many people take advantage of that. So if you don't have that active employment coverage, then you most likely will need to enroll. Some people that are eligible for Part B, such as retired federal employees, need to do further assessment because delaying Part B can result in higher premiums and/or paying more for your health care out of pocket. Coverage based on current employment does not include COBRA, retiree coverage, VA coverage, or the marketplace. So if you delay doing it and were to wait more than 8 months, um, then you would pay a penalty in the future. So, do you want to sign up for Part B? You have to sign up for it if you want to buy a Medigap policy. Your 6 month guaranteed issue right period, which we'll talk about a little more later, starts for Medigap once Part B starts. So that 6 months kicks in anytime you are 65 and older and have started Part B, which is why many people delay it if they have active employment coverage. If you want to join a Medicare Advantage plan, you must have A and B. And TRICARE requires that you have A and B. Some employer coverages would require it. If you only use veterans health care benefits, you may not want Part B. But just keep in mind, there will be a penalty if you sign up late or if you didn't sign up in that initial period. So, when do you enroll in Part B? The 7 month initial enrollment period, that 3 months before the month you turn 65 through 3 months after the month you turn 65. Within 8 months of retiring from active employment, if you miss those cycles, then you can only enroll in the first quarter of each year. If you enroll in that first quarter, your coverage is going to start the first of the month following your enrollment. There will be a 10% of the premium for every 12 months you were eligible for Part B and did not have it. You would pay that late penalty, and you do pay that for the rest of your life. So, if you look at Medicare Part B services, um, you should be receiving your Medicare and You book. Pages 25 through 56 in that give you a complete list of your covered services under Medicare. You're going to see some that have that little blue apple next to it. And those will show you the preventative services. And they will typically be no extra charge on that. You won't pay a coinsurance from any doctor who accepts Medicare assignment. So, how does your insurance work with Medicare? If you have retiree insurance, then Medicare is going to pay first. Your retiree insurance will pay second. If you're 65 or older and you're still covered under active group health insurance from current employment, and that employer has more than 20 employees, your group health plan will pay first. Medicare will be secondary. If that's a company that has less than 20 employees, then Medicare will pay first and your employee coverage would kick in second. Those are the folks typically then would require you to have Part A and B Medicare, even though you're still working. If you're under 65 and have a disability, then your current health plan would pay first as long as they have 100 or more employees. And the only time Medicare would pay first is if you're under 65 and have a disability and your employer has fewer than 100 employees. And then again, that's a situation they would require you to take Part A and B. If you have group health plan and you have end-stage renal disease, and that's why you're eligible for Medicare, then your group health plan is going to pay first, and it's going to pay for the first 30 months after you become eligible to enroll in Medicare. Medicare will pay first after that 30-month period. If you have Medicaid, that's always the payer of last resort, so Medicare will pay first. So this is where you get to make a decision. You can be on the left-hand side of this chart or the right-hand side of this chart. Under Original Medicare, you can go to any doctor, any facility that accepts and treats Medicare patients. You would, under Original Medicare, be required at a minimum to have Part A and B, and you would pick up D unless you had other coverage for that. The second option under Original Medicare is to have Part A and B and D, and then have a Medicare supplement insurance, a Medigap, that would pick up the financial co-insurances from A and B. So it only works with Part A and B, and it only kicks in if a service has been provided under Part A and B. On the other hand, you could pick Medicare Advantage plan. Those would be look more like some of your employer insurances, an HMO or PPO. They will have a network of doctors and facilities, and they will typically have some referrals. They will have some co-insurances. It's a different cost model, but they do include some vision, dental, and hearing that is not covered under original Medicare. So, under original Medicare, yes, you'd be covered if it's medically necessary, like cataract surgery. But just to go get your eyes examined and get a pair of glasses is not covered under original Medicare, other than after you just had cataract surgery. So, if you pick an HMO and you go outside that network of doctors and facilities, then you have no coverage. You would pay all the costs. If you pick a PPO and go outside that network of doctors, then you would have coverage. You would pay more than if you stayed in network. So for people that spend a couple months a year not in the local area, then that may not be a good choice for them. On the other hand, if you're here all the time, it may be a perfect choice for you. If you have a Medicare Advantage plan, you cannot be sold a Medigap. It only backs up original Medicare. So, what do your costs look like if you have no other coverage? So, under original Medicare, if you were to be admitted to the hospital, you would be responsible for $1,736. Then you have 60 days of hospital coverage. And if you need more than that in a benefit period, you start paying a co-insurance per day. For the next 30, that's $434. And for up to 60 more, that's $868 per day. Those last 60 are considered lifetime reserve days. So you might use 10 this year, 10 next year, not use them for a while, but when the 60 are gone, they're gone. On the other hand, if you have a Medigap, it offers you 365 more days of hospital coverage. If you are admitted for at least 3 full days to the hospital, not counting the day you're discharged, and you had to go to a skilled nursing facility, your first 20 days would have no co-insurance. For up to 80 more days, you would pay $217 per day. So this is per benefit period. That is separate from your days of hospitalization over here, in that it's the amount of time that's gone by between getting out of a hospital or skilled nursing facility and going back into one. So, if more than 60 days have gone in between, you will start a new benefit period, which means you would pay that 1736 again. You would start on day count one again. One of the reasons you don't hit too many people hitting those bigger numbers where you're paying co-insurances, et cetera, because hospitals really want you out as quickly as possible. But if you had major accident with operation after operation or a drug-induced coma, something from a stroke, you might be running into those. So I'm going to give you a quick example, and I hope this never happens for any of you. But if you went in the hospital for 10 days in January and came out and did the same thing in February, March, April, May, you're still in the same benefit period and you've used 50 of those 60 hospital days. However, if you went in for 10 days in January and came out and did not go back in until May, more than 60 days have gone in between those. You start all over again and you are responsible for the 1736, and you start day count one again because you're in a new benefit period. So Part B, medical insurance. Again, remember that's your labs, your doctors, your x-rays, durable medical equipment, emergency room, outpatient surgery. So just think of it as all other medical except being inpatient hospital or hospice and skilled nursing facility. You will pay $202.90 per month, which can be income adjusted upwards, which we'll talk about later. And that, if you are taking Social Security, that will come right out of your Social Security before your money is sent to you. If you are not yet taking Social Security, you will get a quarterly bill for three times that amount, and you can pay it directly, set it up to be paid directly. You can do an appeal to have that shifted to a monthly versus quarterly if that works better for you. There is a Part B deductible. So the first $283 you spend on those in a year, you are responsible for. After that, Medicare is going to pick up 80% of the cost. You would pick up 20% of the cost. If you go to a doctor or facility who does not accept assignment, that's someone who has not agreed to the Medicare rate, they can charge up to 15% more against the charge that Medicare allows. A lot of people avoid that by just asking the question right up front. Sometimes you don't have a choice. Anesthesiologist, you're not going to have a choice on that. But it's just something to be aware of that they could charge you more. If that doctor's bill is 250, the rate from Medicare might be 100. In that scenario, after you've covered that first 283, Medicare is going to pay $80. You're responsible for $20 as long as they accept assignment. If not, you could be responsible up to $15 more. So you see some of the costs you might incur. This is why some people will add supplemental coverage, a Medigap. And again, it's a financial vehicle. It's designed to pick up the coinsurances and deductibles. So what is a Medigap policy? It's designed to supplement your original Medicare. It can pay deductibles or coinsurances from Part A and B. These are private companies. You'll hear it called Medicare Supplement insurance policies or Medigap, and they are standardized plans. So all plans that have the same letter are going to do the exact same financial coverage, but you will see costs varying from one company to another because it is based on what's approved for them on the claims they've paid out. So you may not need a Medigap. First off, you can choose not to have any secondary, but you may not need one anyway. So if you have Medicaid, a retiree health plan, TRICARE, or VA healthcare, you you are going to probably be pretty well covered, and you might decide you don't want a Medigap. So the other decision you have to make is paying Medigap premiums feasible for you. So some people that will sign up for a Medigap, a lot of the reason they want to do it is because they're on a fixed income and they would like their medical costs to be as predictable as possible. So these are your Medigap plan types that you can choose from in 2026. If you go across the rows, you will see that it's showing those deductibles and coinsurances that I walked you through on the previous page. The 1736 if you're admitted to the hospital. You'll also notice that there is not an X across the whole row assigned to the 283 Part B deductible. That's because anyone who turned 65 after 1/1 of 2020, there are no plans available to you that would cover that 283. So if you go down the columns, if there's an X in there, it means it pays 100% of that. If it's empty, it doesn't pay anything. So I'm going to talk to two types and one variation on the one type. And I'm doing these because they're the most commonly chosen. So if you pick a G Medigap plan, after you've covered that first $283 deductible, it is going to pick up any other of those co-insurances and deductibles that you saw on the earlier chart. If you pick an N, it is going to look much like a G, but you'll see the footnote down at the bottom, the three asterisks. When you go to a doctor's office or facility, you will pay up to $20 co-pay. And if you go to an emergency room and you're not admitted, you'll pay up to $50. If you're admitted, you do not pay that. The other difference from a G is you will see there is no X in the row that's associated with the excess charges. Those are the 15% that doctors could charge you if they have not accepted assignment. You would be responsible for that extra 50, up to 15%. The G high deductible you can think of as sort of catastrophic coverage. So in that scenario, if you look at the footnote at the bottom, you're going to pay any of the deductibles and co-insurances that you incur in a given year up to the deductible in 2026 of $29.50. After that, you look just like a standard G. That's become more popular as more people have 401ks and 403bs because they have assets set aside. And when I go through the rates next week, you will see that that is much less expensive per month. So your G is going to be your highest cost premiums, and N will be less than that, and it'll be somewhere in between the G and the G high deductible. The G high deductible is going to be one of your lower cost plans. So in a year that you do not incur a lot, you may save a whole lot of money having a G high deductible. But there might be times you're paying that full $29.50, but you know you have that upper limit on what you're spending. So how do you find the right Medigap policy for you? So when you listen to our part two or come to the part two class, we are going to be spending basically all the time on comparing Medigaps and Medicare Advantage plans. But if you want to go look at this now and understand it better, you can go out to Medicare.gov and you can go out to the Maryland Insurance Administration. You can also get in touch with us, and we have printed booklets of what's out on the site at Medicare and at Maryland Insurance. And that'll give you every company that can offer you a Medigap in the state of Maryland. A lot of people for the first go around find it easier to work from the booklet. Okay, so we've dealt with Part A and B under Original Medicare. You can make that decision whether you want a secondary or need, a secondary. And then you have to decide about drug coverage. So you have to have either Part A and or B to be able to pick up prescription drug coverage. There is no automatic enrollment in this. You have to actively enroll yourself. You can delay enrollment with no penalty as long as you have creditable drug coverage. And that's just an equation that says the coverage you have is equal to or better than the coverage that you would have through Medicare. Drug plans are required to notify you each year to let you know if your drug coverage is creditable or not. It is creditable drug coverage as long as you fall in one of these categories. So your employer or union health coverage, COBRA, unlike Part B, COBRA does count as active, creditable drug coverage. Medicaid, FEHB, Veterans, CHAMP VA, TRICARE, Indian Health. So when you get your information each year that says you have creditable drug coverage, just hold on to that. A lot of times it's even one page in your explanation of anything that's changed for that year. So just, keep that, hold on to that. You probably will not need it, but if you've changed companies a lot of time and you go to get your drug coverage and they say, well, you haven't had creditable drug coverage, that's your proof that you've had it. So when can you enroll in a Part D? You can enroll in it during your 7-month initial enrollment period. Again, that's that 3 months prior to versus, through 3 months past the month you turn 65. You can do it every year during open enrollment period, that every year from October 15th through December 7th each year. And you can look at this, and coverage for that would begin January 1. When you are applying anytime other than open enrollment, then it's going to start the first of the following month. It will never start before your first effective date for Part A or B. So you can also join, there's some special enrollment periods. You can join within 63 days of losing employer or retiree creditable coverage. So whereas on the Part B, you had up to 8 months, here you have 63 days. If you don't within the appropriate period, then there will be a late enrollment period of 1% of the base rate. And that is something that is determined by an equation at CMS in 2026. It's approximately 39 cents. And it's 39 cents for each month that you didn't have Part D. And that becomes cumulative when you finally pick up Part D. And you will pay that the rest of your life. So, okay, so what are you going to pay for your Part D prescription drug plan? You'll have a monthly premium that you're going to pay whatever that plan premium is. That could be a base price plus an income adjustment upwards again. If you have a penalty, that's going to be added on to that monthly premium. There is once a year, there's a yearly deductible that may or may not affect you and can be from $0 to $615 in 2026. The reason it may not affect you is it doesn't really come into play on tier 1 and 2 drugs, so your standard generic drugs. For drugs that are on the plan's formulary, you will then have a co-payment or co-insurance. And when you look at this or have us look at it for you the first time, you're going to want to look at preferred pharmacies because they're going to be less expensive. So the things for figuring out the best plan for you are going to be the preferred pharmacies, whether your drug is on the formulary, prior authorizations. That's going to be a situation where your doctor would have to connect with the plan to get a prior authorization, or step therapy. And that can be a situation where they're going to require you to go through using a generic first before they would approve of you um, having the brand name. So there is a very nice tool. It's called the Medicare Plan Finder out on Medicare.gov. You can go out there anytime and play with some of the Plan Finder to see what your drug plan is going to cost you in a given cycle. Once you've set up your own account, it'll actually save the information you put out there. So you can call the plan directly, but that means you'd have to know the plans and their numbers, etc. It's not the most convenient thing to do. You can call Central Medicare and they can work with you over the phone to use the plan finder to help you find one. Or you can call us and come in and see us and we can help you find one. So open enrollment, again, that occurs October 15th through December 7th of every year. We do recommend that you look at both Medicare Advantage plans and Part D prescription plans every year since they run on an annual basis. The plans will change, your conditions may change, your prescriptions may change, and they have new plans that are in effect every year, January 1. So please review them We have people that don't and are paying a lot more money sometimes than they need to. So that is original Medicare. Again, you can have that as Part A, B, and D, or Part A and B financially backed up by a Medigap or some other secondary, and D. So now let's switch over to the Medicare Advantage plans. Again, these are regionally based plans. They're actually offered by county. They will have A and B, and unless you have something like veterans where you can do your prescription drugs through veterans, or some other creditable coverage drug plan, then you will pick a plan that has A, B, and D in it. Regionally based. So you have to, again, have Part A and Part B to join. You will pay still your Part B premium, whether you're under original Medicare or Medicare Advantage plan. You normally will be required to use a network or obtain a referral to see a specialist. There will be co-pays and co-insurances that may apply, but you can have some added benefits, the dental, the vision, and the hearing. If you join a Medicare Advantage plan, you may not be sold either a Part D standard prescription drug plan or a Medicare Supplement insurance, Medigap. So these are the plans that are offered in Carroll County in 2026. Again, we'll talk about these a lot more next week. But you can see we have, a lot of HMOs, less number of PPOs. If you can only take the ones that are below the D-SNP Advantage plan, and those are only available to folks who are on Medicaid. So you have to have Medicare and Medicaid to be eligible for any of those. So when can you enroll in that Advantage plan? Again, during your 7-month initial enrollment period, the 3 months before through the 3 months after the month you turn 65. You can enroll any open enrollment period, and that's at October 15th through December 7th each year, and that coverage would begin January 1. And then there are some other times that are special enrollment periods. By the way, those special enrollment periods would normally be associated with moving or losing coverage from an employer, that type of thing. I am not going to walk through a lot on this chart, but it's there for your information. It gives you a high-level summary of the differences that I talked about when I said you could pick original Medicare or you would pick a Medicare Advantage plan. So they have different pluses and minuses. That's why it's real important for you to kind of review it, sit with us and review it if that makes sense. And we go from there. There is no upper out-of-pocket limit down near the bottom on original Medicare. So if you do not have any kind of secondary, whatever of those coinsurances you incur, you will be responsible for, which is why a lot of people pick a Medigap or have a secondary. There is an annual out-of-pocket limit if you're over on the Medicare Advantage side of the equation. After you hit that out-of-pocket limit, then your plan is going to pay the full cost of your care after you would reach that limit. They're pretty high numbers, and we will talk about all that in much more detail in part 2. The other thing that does jump out a little bit is you will get a Medicare summary notice. That comes out quarterly if you're under original Medicare, whereas beneficiaries under Advantage plans will get them monthly as an explanation of benefits. So once you have a Medicare number, you can create your own account with Medicare, not to be confused with your personal Social Security account. This is a separate Medicare account. Within that, there are a lot of things you can do once you get that set up. So you can view your Medicare claims and your Medicare summary notices. You can have it sent just online versus to your home. You can manage your prescription drug and other personal health information. You can see where you stand on your Part B deductible. Um, so, you can get questions answered. You can do all kinds of searches out there. The searches you can do even before you have your own account. But if you wanted to save the information and look at some of these other things, you would need to set up an account. So this is the site you would go out to. It's www.medicare.gov. And if you don't yet have a Medicare number, you're going to go to the bucket you see called Find Health and Drug Plans. And again, that'll let you look and compare, etc. Once you have your Medicare number, it's to your advantage to create an account. And then anytime you go in, you're going to go into the area that says log in or create account. And then it's going to save whatever you are doing there. I'm going to switch gears now. Some of you may be eligible for certain financial assistance. The first three programs, so the first three rows, are federal programs. They have both an income and an asset test. And if you qualify for these, Quimby is going to be very similar to Medicaid benefits. So it's going to pay your Part A and B premiums. It's going to pay your deductibles and that 20%, the coinsurance. But you have to have met both conditions. If you have a 401k, for instance, that is an asset sitting there. It does not count in your income as it's in that bucket. If you start taking distributions from that asset, then you need to include that in your monthly income. So you'll see the limits there. You have a slightly higher income limit that you would qualify, but the same asset tests that you would qualify for SLIMB or specified low income Medicare beneficiary. That is not going to pay all the things that Quimby did. It's going to pay just your Part B premium. If you qualify for both of those, you automatically qualify for Social Security Extra Help. That's designed to help you on your drug costs, whereas the first two are designed to help you with your medical costs. You'll see that you might qualify there even if you didn't qualify for the higher ones. And you would want to apply because what will happen is you'll get much lower costs on your premiums. It might pay your whole premium, your deductibles, your copays. The last one, Senior Prescription Drug Assistance Program, is one that we have a lot of people in Carroll County on, and there are two reasons. One is because there is no asset test, so you're not hurt by the fact you have savings or 401ks, etc. But you'll also notice the income limit is much higher. This is a state-run program. The others are federal. It will, for each of you, if you're a couple, pay up to $100 towards your drug premium. So if your drug premium's 30, it's going to cover that. If it's 100, it's going to cover that. The other benefit of being eligible for Speed App is that you can, once during that calendar year, you wouldn't have to wait until the next open enrollment. You could actually change drug coverage. Let's say you got something prescribed to you that is not on your formulary, and there might be a drug plan that's better. You would be able to change it during the year. Senior Medicare Patrol is the other role that we in SHIP. We are both SHIP and Senior Medicare Patrol. For fiscal year 2024, Medicare reported 54.4 billion in improper payments, and that can be documentation, fraud, errors, abuse. But the whole point of SMP is to detect, prevent, and report Medicare fraud. And you are the first line of defense for this. So first off, you need to protect yourself against Medicare fraud and abuse. So treat your Medicare card and number as if it were a credit card. Look for anything that does not look right to you. And don't be giving your Medicare card to other people to do things for you. The only people you should be giving those to is to your providers, Central Medicare if you call into them. If you come to us, we will need it. But that's you should not be giving them to other people other than that. Um, please be aware, Medicare will not call you or come to your door to sell you something. If someone's trying to do that, feel free to hang up or never answer. And you do not need to talk to them because it is not going to be Medicare that's contacting you. It's going to be, could be a broker, it could be a scam, it could be all kinds of things. So just be very wary about that. The other thing we absolutely need you to do is to review your Medicare summary notices. So look on it and see if there are services that you did not receive. Look on it and see if you saw the same thing 2 different months in a row and you only had it done once, right? So it's double billing on that same date, that kind of thing. Look to see if there are things that your doctor didn't order. If you find some of those, first call the provider because it could be as simple as it got billed to the wrong patient. After that, you want to gather information and documentation. And you can contact SMP, which would be either ourselves or Central Medicare. And it's a free and confidential service, and we can help you sort through who needs to be contacted and whether, it looks like something needs to be pursued. I told you earlier that some of you would pay a higher premium. That's the income-related Medicare adjustment amount. They will look at your federal income tax from 2 years earlier, and you'll look at these different tables. If you're under the 109 modified adjusted gross income as an individual, or under the 218 for a couple that filed jointly, then you're going to pay the 202.90, the standard. If you make more than that, you're going to pay whatever it falls into. And as you can see, that can get much more expensive. And again, this is all per person. If you are married and you were living in the same household with your spouse anytime during the year, but file separate tax returns, then you're going to pay you can pay a much higher amount, as you will see there. So again, based on your 2024. There is also an income adjustment for Part D. Same concept with the table. You're going to pay whatever your plan premium is for that particular plan and add to it this IRMA amount. Same thing is if you are filing singly when you've still married and live with a spouse part of the year, you're going to pay more. This is the point where normally you can ask questions. Just as a reminder, we are the Carroll County SHIP and SMP office. If you would like to get in touch with us with either questions, setting up appointments, etc., picking up booklets, you can contact Kristen Harvey. She is the one Carroll County employee. The rest of us are volunteers. You can leave a message on that phone number or contact her via email. Please do not do repetitive calls. She will get back to you, but she gets a very large number of calls, so please don't block it up. Appreciate you listening to this. Please feel free to take a brief survey for us if you would like to. If it'll ask you the presenter's name, and my name is Lois, Lois. So again, thank you for joining us. That's all.